Dr. Bebot here. Let's do our medical word of the day. A friend of mine asked me to do this one. She's been getting some questions about it. She's a trauma nurse. And the one I want to do today is rhabdomyolysis. Rhabdomyolysis is the breakdown of muscle tissue. And it can cause some very severe problems. Rhabdomyolysis can be caused by several different things. Really, the top three would be trauma or crush injury to the muscle. Certain drugs can do it, and excessive physical exercise. And by excessive physical exercise, I mean excessive physical exercise. I'll tell you a little case history of one that I saw when I was working in the emergency room. I had a young man that took a bunch of acid and decided to run. And he ran 11 miles barefooted. He wore all the skin down to the subcutaneous tissue off the bottom of his feet. It caused such damage and such problems with rhabdomyolysis, he went into renal failure. And that is the major complication of rhabdomyolysis or rhabdomyolysis. And that is kidney failure. What happens is the muscles break down, the cells burst apart, and they release all their contents into the bloodstream. One of the contents that's released is called myoglobin. And myoglobin is a big protein, and it will stop up all the tubules in your kidneys and send you into acute renal failure. So it's a very, very serious problem. If you lay on an arm for too long, you see this with some alcoholics. Sometimes they fall asleep on their arm and they end up with a crush injury of their arm from their head laying on it, and that can cause rhabdomyolysis. Some illnesses can do it, viral illnesses and such, but they're not as common as the top three that I mentioned above. Treatment: fluids. Just wash it out the best you can. That is probably the biggest takeaway from this. If you do excessive exercise, drink. Stay hydrated. Dehydration is your enemy. So there we have our medical word of the day, rhabdomyolysis.